What's good, Hoopers? My name is Marco Lopez, Doctor of Physical Therapy and co-founder of the Basketball Doctors. Our goal with the Basketball Doctors is to provide the most evidence-based information regarding rehab, injuries, and injury prevention for basketball players. And this is all educational information, not medical advice. If you have any issues, please reach out to us or reach out to your local physician or physical therapist. But to go on to today's topic, we're going to talk about anterior knee pain for basketball players. So anterior knee pain, or pain in the front of the knee, is the most common injury we have with basketball players. And there's different kind of diagnoses within anterior knee pain. And you probably noticed it yourself. I think anyone that's played basketball before has had some kind of pain in the front of the knee. Today we're going to break down the three main diagnoses with anterior knee pain and give you guys the signs and symptoms and some of the tools that we use for rehab. So let's just jump into it. So the first injury we're going to go over is patellofemoral pain syndrome. So patellofemoral pain syndrome is another word for pain on the kneecap. Here's your kneecap, here's your knee. A lot of the times people have, actually this is probably the most common injury, patellofemoral pain syndrome, because it gets often confused with jumper's knee and the other injury that we're going to go over, Osgood Schlatters. But patellofemoral pain syndrome does not discriminate. People get affected with this injury since the age of 12. And a lot of the times it's issues with the kneecap tracking or any other issue around the kneecap. So sometimes you're gonna have pain here on the kneecap. Sometimes it refers out to the outside of the kneecap, meaning like it's like that IT band syndrome. Sometimes it might even refer a little bit down into the patellar tendon. The risk factors for patellofemoral pain syndrome are usually girls get this more than guys. And another thing is weak hips, weak quads, and you put a lot of pressure here on the kneecap. So the biggest thing we got to know about the kneecap too is that it moves different directions. So it moves to the outside, inside, up, and down. So if anything is disrupted with this kneecap mobility, that might increase your risk for patellofemoral pain syndrome. And some of the signs and symptoms. So usually people report pain when they're sitting down for a long period of time. So when you're sitting down for a long period of time, your knee's bent, that's going to put a lot of pressure here on the kneecap. If there's any damage here, and that's what's going to give you pain. Another issue is people going downstairs or going downhill, because when you're going downhill, your knee's bent, putting a lot of stress on that kneecap, and if your quad's not strong enough, it's going to put a lot of pain here in the patellofemoral joint here. Another symptom is people kind of call it as like the IT band syndrome, or like, oh, it hurts in the outside part of my knee, but that's more usually patellofemoral pain syndrome. So those are kind of some of the signs and symptoms and risk factors for patellofemoral pain syndrome. So just to quickly summarize it, it's pain on the kneecap. So you're not going to have, and on the side of the kneecap, this is the most common diagnosis. And we need to differentiate it from the other diagnoses, because what we do with this kind of injury is completely different from our next injury, which is jumper's knee. So jumper's knee is another super common injury with basketball players. It often gets mistaken with patellofemoral pain syndrome. So not a lot of people have true jumper's knee, but a lot of people have patellofemoral pain syndrome that refers to more of that jumper's knee. But jumper's knee is an issue with the patellar tendon. So if you want to learn more about jumper's knee, check this video out. We go into further detail, but I'll give you guys a quick little summary. So what happens is it's not tendinitis, so it's not an inflammatory issue. We also have another video here if you click on the link between patellar tendinitis and patellar tendinopathy, which is jumper's knee. But it's not an inflammatory issue. It's more of a tendinopathy degeneration issue, meaning this tendon just gets overloaded and overworked to the point that it's reached its capacity limits, and then you start having pain when you're playing basketball or jumping. But some of the risk factors for this, it's actually men have it more than females, and people that are playing jumping and cutting sports are more at risk. Another thing too is people that are more quad dominant. So basketball players and volleyball players use more of their quads because they're always jumping. That puts a lot of stress here on that patellar tendon. Usually in the age range of this, usually people have it after the age of 16 or so. And it gets confused with the other injury that we're going to go over, but most of the time if you're over the age of 16, it's most likely jumper's knee. Another risk factor that we tell people, or one of the tests that we use, is a decline squat test. So if you're let's say you're on a platform. Here we have a video here that goes into more details of this decline squat test, but you're pretty much squatting with one leg with your heel elevated, and if you have pain in the patellar tendon and you have pain with jumping and running, it's most likely you have jumper's knee. And the treatment for jumper's knee is going to be way different than the treatment for patellofemoral pain syndrome, because with the exercises for jumper's knee sometimes get aggravated with patellofemoral pain. So that's one of the biggest things we have to differentiate. And also, with jumper's knee, it's okay to rehab through some pain. However, with patellofemoral pain syndrome, we don't like rehabbing through some pain. We only like rehabbing with some minimal pain if it's a tendon injury, but not so much a kneecap issue. But like I mentioned, jumper's knee, you're at risk if you play a jumping sport. It usually happens after around 4 to 6 weeks because it's more of a chronic issue, tendon degeneration issue, as opposed to inflammatory issue. And that differs between our last diagnosis, which is Osgood Schlatters. So Osgood Schlatters is commonly mistaken with jumper's knee, but there's a big key factor that differentiates both of them. One is that Osgood Schlatters, you're gonna have a painful bump below your knee. So I don't know if you've seen people, their bumps kind of, if you look at their kneecap and it's right below, there's a bump that kind of sticks out. That bump that sticks out is the tibial tuberosity. And the Osgood Schlatters, what happens is we keep on, let's say, playing basketball, running, and as we're growing at a rate that our bones are growing faster than our muscles and our tendons. This bone sticks out and we keep on pulling here. That's gonna lead to stress reaction here in the tibial tuberosity, and that's why they have that painful bump there. But usually the people that are at risk for this is athletes who had a recent growth spurt. So if they just grew or are growing, they're gonna have some pain here. So usually this is affected most on kids that are under the age of 16 that are playing sports. Another risk factor is if they're quad dominant, if they use too much of their quads, and that puts a lot of stress here in Osgood Schlatters. Also, one test that we like to use to make sure you have Osgood Schlatters is one, palpation, we press on here. Two is we do a manual resistance test. So what happens is they'll be off the edge here and they'll try to kick out their leg and we provide resistance. And if it hurts, it's probably Osgood Schlatters because they're activating their quad muscle, pulling on this tibial tuberosity, causing that pain there. And the biggest thing is we need to differentiate between these three diagnoses because, like I mentioned earlier, the rehab is completely different on each one. So for Osgood Schlatters, we're not going to be doing the exercises for jumper's knee because it's actually going to make this Osgood Schlatters problem even worse, because with Osgood Schlatters, check out we have a 14-week program for it. But the biggest thing for this Osgood Schlatters is we have to be working on strengthening the backside, the posterior chain, and stretching out the front side. Because if we strengthen too much of the front side, it's going to keep on pulling and lead to an avulsion fracture. Jumper's knee, we have to be really strengthening the tendon and also strengthening the glutes and posterior chain. So if we do, let's say, jumper's knee to Osgood Schlatters, that might make things worse. And that's why we have two separate programs. We have a jumper's knee program, which is 8 weeks, 5 days a week. And then we have an Osgood Schlatters program, which is 14 weeks. So click on our website. We also click the link below. We have those two different programs, which are completely different in their rehab approach. The third one is patellofemoral pain syndrome. This one's much more advanced because there's different issues that might be contributing to. One, it could be ankle mobility. Two, could be flexibility of the quad. Could be weakness of the glute. Could be abnormal mechanics. So there's a lot of things with patellofemoral pain syndrome that could be causing that pain. So those are the kind of three diagnoses. We have patellofemoral pain syndrome, jumper's knee, and Osgood Schlatters. So where your pain is usually dictates what the pain is. So hopefully you guys learned a lot about anterior knee pain. Comment below what anterior knee pain you have and any questions regarding it, and hopefully we can help you. But hit the like button, hit the subscribe button, try to get this video out to as many players that are dealing with anterior knee pain as possible. But we are the basketball doctors. Let's ball for life.